Should we get started?
Good morning, Suresh. How are you?
Good morning. Good morning, Sudhakar. Good morning, Sundy.
Good morning.
Good morning, everyone. Good morning, Joseph.
Let me see if I can change my...
The world is scrambling to stop the spread of COVID-19. More and more cases are popping up in countries far from the epicenter of the outbreak. Tonight, there are more than 85,000 confirmed cases around the world. More than 2,000 people have died, mostly in China.
The COVID-19 pandemic. Hundreds of thousands dead, millions sick. Partisan politics will not get us through this crisis. Enter Beyond the COVID-19 Pandemic, the revolutionary book that delivers a much-needed new approach to healthcare.
Good morning, good evening, good day to everyone. Welcome to the first online book launch on Beyond COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare. I'm Suresh Shenoy, an alumnus of IIT Bombay and president of the Wheels Global Foundation. The tagline for Wheels, Technology-Enabled Philanthropy, says it all. We seek to help implement technology solutions for water, health, energy, education, livelihoods, and sustainability. Where solutions do not exist, we encourage research and development at the IITs and other similar institutions through sponsorship. In addition, Wheels is also a think tank with several prominent alumni, partners, industry leaders, and government officials participating. These officials have participated in thought leadership conferences and webinars to exchange ideas for best practices that help in how policy is formulated, as well as the impact on institutions and people everywhere. The COVID pandemic has demonstrated how we are all a connected world, where most interactions have become digital. There is not a single day that goes by where there is no talk of how health analytics, science, and technologies such as artificial intelligence, machine learning, and genetics and other technologies are complementing diagnostics, development of vaccines, and facilitating treatment. In this sense, science, engineering, technology, and medicine are coming together in ways that are overwhelming. Policymakers are playing catch-up on issues such as algorithmic decision-making, privacy, data protection, insurance, and liability coverages. Today's event to launch the book, Beyond COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare, is therefore extremely timely. And we are proud that the authors, Ambassador Pradeep Kapur and Dr. Joseph Chali, are members of PANIIT, Wheels, and AAPI, the American Association of Physicians of Indian Origin. You'll hear from each of them about their experience in co-authoring this book. In addition, we are honored and proud to have with us Mr. Aneesh Chopra, the first chief technology officer in the USA who served in the Obama administration. He's an entrepreneur who has had a successful company in healthcare analytics and himself an author of a book on healthcare. He has kindly consented to deliver the keynote address and participate in a dialogue with the authors. This event is co-hosted by the Indo-American Press Club, IAPC, the largest ethnic Indian American media organization formed to bring together media groups and the Indian diaspora media fraternity across North America under one umbrella to work together, support one another, and provide a unified voice to the mainstream media world and larger community. I must add that the authors have most generously agreed to donate proceeds from the book sales to Wheels Global Foundation, to PANIIT, and AAPI. If you go to our website, wheelsglobal.org, you can buy a limited edition hardbound copy of the book for $60. And donations above $75 will receive the book signed by the authors. And donations about $500 are entitled to a one-on-one Zoom meeting with the authors for 60 minutes at a mutually convenient time. I can guarantee you it's well worth it because these gentlemen are extremely well informed. I'm now pleased to introduce our moderator for this event, Mr. Yogesh Andley. He's a serial entrepreneur and director of Wheels Charitable Foundation. Over to you, Yogesh. You're on mute. And I think he might be having some issues.
Yes,
Okay.
Thank you, Suresh.
You're welcome.
I have a little unstable connection at my end, and therefore I have switched off my video to make it a little better for the audio to flow through. So
You
I'm
look good either
looking
way.
forward to discussing this very interesting and timely publication. But first, let me start with some housekeeping messages. All attendees are on mute through the event. You may ask questions to the speakers by entering it in the Q&A box. If you need any help, you can chat with one of us by raising your hand or typing your request in the chat box. You may also send us your questions by email to info@wheelsglobal.org. A recording of this event will also be available on our website and on YouTube and Facebook. Questions from the audience will be curated and channeled to the speakers by myself and Chairman Mr. Suresh Shenoy. My bio, as also the bios of all speakers, will be projected on the screen. In the interest of time, I'll make brief introductions and request you to refer to our banners and website www.wheelsglobal.org for more details on our distinguished speaker and where you can also buy the book. It's now my distinct honor and pleasure to introduce Mr. Sundaram Srivasan, whom we lovingly call Sundy, President of IIT USA as well. He is an alumnus of IIT Delhi, BTech Mechanical Engineering 1984, and MBA from MIT Sloan School of Management. He serves as Chief Operating Officer at Zentech and has worked as a senior advisor for BP. He has been a judge for the last 10 years in world's largest business plan competition at Rice Alliance and mentors and advises startup companies. Sundy was the first founding president of IIT Alumni of Greater Houston, IIT AGH. So Sundy, over to you. We invite you to share your thoughts about this book.
Thank you. Thank you so much, Yogesh, and thank you very much, Suresh, Ambassador Kapur, Dr. Joseph, for this opportunity. I thank you not just on behalf of myself as a good personal friend, but also on behalf of the PANIIT USA, which is an organization representing close to or around 50,000 members here in the USA. So some very quick words about the PANIIT USA. We are basically, we basically exist, and we are geared to provide alumni services and branding for the IITs. I just want to make one very important announcement, I guess. We are hosting a mega summit on December 4th and 5th, 2020. Please go to www.iit2020.org. Do register and attend. There is also a major section on health. So in that sense, it kind of links with today's event. But today is not about the PANIIT. Today is all about this book, Beyond the COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare by Ambassador Kapur and Dr. Joseph Chali. I'm extremely privileged to be sharing some thoughts on this great book, which, as many of the speakers before me have alluded to, is very, very timely indeed. You know, in the ideal utopian world, healthcare should be like the fire engines of the fire department, ever ready, but hopefully not called upon. Right? Unfortunately, as we all know, this is not the case. It's called upon a lot more often than we would like. And no amount of preparation could have even begun to prepare all of us for a pandemic like COVID-19, forcing us to realize, I guess, that we as individuals, as a society, and as global citizens need to fundamentally, entirely rethink the concept as well as the delivery of healthcare. And these two authors have, in a sense, done just that, right? The other part of healthcare is that collaboration among disciplines is a very, very key element for success. I kind of put these three things around 3 points of a triangle. You know, there's of course the medical aspect, there's the technology aspect, but there's also a very important public policy aspect. You know, the societal mechanisms of delivery of the healthcare. And somehow there is an important glue element of the media as well on top of this, because whatever the concept, it has to be sold as well, right, to the public. So the reason I put these three triangles on the glue is to show you that in Ambassador Kapur and Dr. Chali, all these elements are covered. Ambassador Kapur is from the IIT. He covers the technology part. Dr. Chali, of course, the doctor, he covers the medical part. Something that not all of you may know, incidentally, both of them very strongly cover the government policy-making part, as they've been very actively involved in government and policy-making, both in India and the US. And to add icing to the cake, Dr. Chali has been actively involved in the media as well. So my point, every aspect of sound healthcare methodology has been addressed very adequately in this book. So without being a spoiler and revealing too much about what's in the book itself, if some of you are wondering, it's a book on healthcare, where does technology come in? You know, if you think about it a little, when you start delivering the healthcare, for example, remotely, there are data privacy issues, there are liability issues. You know, suppose something goes wrong, who's at fault? Was it the medical aspect of it, or was it the technology that delivered it, right? And so on. So big data kind of becomes crucial in managing countrywide healthcare access, especially where there's diversity, whether it's diversity in geography, diversity in cultures, diversity in medical conditions, and so on and so forth. In any event, I was very, very honored to be requested by the authors to write a little bit about what I thought about the book, because I was given a sneak preview. And I'm going to just share with you what I wrote about the book. I'm going to read exactly what I wrote about the book, right? Extremely well-researched, comprehensive, truly visionary. Quantum-fold leaps of mankind have only come from positive, disruptive innovation. This book does just that. Policymakers and the nation will be very well served by implementing as many ideas generated in this treatise, if not all of them. My final thoughts, and this was really, I was touched. I don't know if you missed it. I want to repeat it. The authors have zero commercial motivation. All the proceeds going to charity. So please get your copy today at wheelsglobal.org. And as I said, today is all about the book. And the book is Beyond the COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare by Ambassador Pradeep Kapur and Dr. Joseph Chali. Thank you.
Thank you, Sundy. Our next speaker is Dr. Sudhakar Janalagada. He is the newly elected president of AAPI, the American Association of Physicians of Indian origin, which has a diverse membership of 80,000 doctors in the USA. He is a board certified gastroenterologist and transplant hepatologist working in Douglas, Georgia. A former assistant professor at the Medical College of Georgia, former president of Coffee Regional Medical Staff 2018, has served as a director of Medical Association of Georgia Board from 2016 onwards. There's a long list of qualifications and positions, public positions he has held. So over to you, Dr. Sudhakar, for sharing your observations on this book and COVID-19 too. Over to you.
Thank you very much for the kind introduction. And again, thank you for invitation. Good morning to North America and good evening to Indian friends. COVID-19 pandemic had made it clear that ensuring affordable and timely access to care in healthcare is a priority. As the pandemic began, it quickly became apparent that healthcare systems were ill-prepared. Ambassador Pradeep Kapur, an expert in policy, and Dr. Joseph Chali, an expert in healthcare and fellow AAPI member, came together to offer readers a rare insight into the current state of affairs of global policy in healthcare. In their book, Beyond the COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare, they share how past the public policy at the global and local levels has impacted healthcare, particularly in the United States. The author discussed the challenges of healthcare delivery, including the providing quality, affordable patient care to all, education, and sustainable lifestyle choices, an alternate template for health insurance. They advocate for patient-centered healthcare. Coming to the technology, we have now come to depend on technology in health, social media, and telehealth as a way to meet needs of patients. The digital revolution has transformed many aspects of life. We need to understand how digital technology are being harnessed for the public health response to COVID-19 worldwide. Digital technology can supplement clinical and laboratory notification through the use of symptom-based case identification and widespread access to the community testing and self-testing with automation and acceleration of reporting to public health database. I'm truly grateful to Dr. Chali and Ambassador Kapur for donating a portion of the book to Income to AAPI. I wish both very best and hope millions of people will read this book. Thank you again for the invitation.
Suresh, would you like to introduce Aneesh, our keynote speaker today?
Indeed, he would.
Mute. Okay. Sorry about that. Thanks again, Sudhakar, for your very kind remarks. And now it is my distinct honor and privilege to introduce our keynote speaker, Mr. Aneesh Chopra. Aneesh is the president of Care Journey, an open data membership service, building a trusted, transparent rating system for physicians, networks, facilities, and markets on the move to value. He served as the first US Chief Technology Officer under President Obama from 2009 through 2012. In 2014, Aneesh authored Innovative State, How New Technologies Can Transform Government. He serves on the boards of the Healthcare Cost Institute, International Digital Accountability Council, and the New Jersey Innovation Institute. Aneesh has earned his master's in public policy from Harvard Kennedy School, and a bachelor's from the Johns Hopkins University. I feel privileged to call him a friend. Welcome, Aneesh. Over to you.
Thank you very much, Suresh. And again, to celebrate what I believe to be a very important contribution to the dialogue by Ambassador Kapur and by Dr. Chali. I'm grateful that you've taken the time to write this book while you've been touted earlier for your contributions in supporting the charitable causes with the proceeds. I thought I would spend a few minutes with you this morning trying to put all of this in context and hopefully issuing a call to action so we can take the ideas, the grand plan that you'll learn more about throughout this discussion as written by these esteemed authors into implementation. So a little bit of personal history. I'll talk a bit about my journey from India with my mom and dad, and then a bit of the pandemic we have in the US and globally, and then a bit about how it relates to the strategies that were outlined in the book. If I may, just as a point of personal privilege, my father had gone to college with a gentleman by the name of Sam Petroda. He was a few years junior to Sam, but throughout my childhood, we'd always looked up to the legendary man with the great mane. Sam was an inspiration for me because he was a problem solver. When in the US, we might find ourselves grappling with complicated issues. How do we extend broadband access to every American, as an example? Sam refused to take the traditional path and explore the debate between whether the government should subsidize and extend a good or allow the free market to work on its own, all the while keeping the cost of the good out of reach for most people. Sam's idea was to innovate and to build a better future. Sam's work, leading in the original 1980s with CSAM, led to breakthrough technologies that dramatically lowered the cost to connect every rural village in India to the telecommunications infrastructure of the time that was modern. Digital communications at a time when the world had been adopting more expensive legacy analog alternatives. I had the honor and privilege of serving as Chief Technology Officer under President Obama at the same time that my guru and hero, Sam Petroda, served as the effectively Chief Technology Officer for the Government of India. And during our time together, we had the honor and privilege of joining hands to bring the two countries together digitally in launching a US-India open government dialogue, which led to the result of an open source technology platform that's freely available around the world, data.gov.in. I share that history and story because I'll come back to the call to action that we're reading in this book and the opportunities for US and India leadership in bringing about the vision and the grand plan as so artfully written. The pandemic we're witnessing right now is of two dimensions: the obvious human cost that we see suffering around the world, but more importantly, the systemic failures and the processes that have led our collective inability to contain what is the first of likely many pandemics. I'd like to share a bit about this systemic challenge at the outset. I spent a decade thinking about healthcare data and ways in which we could modernize the infrastructure. Prior to my time in the US government, I was Virginia's Secretary of Technology, and under the outgoing Governor Mark Warner and my boss, Governor Tim Kaine, we made an investment in electronic health records to build what we thought was sort of a model for how the country might open up and share health information so we could make smarter decisions. The Obama administration invested $35 billion subsidizing electronic health records across the nation's hospitals, doctors' offices, clinics, and now health plans. Yet, at the start of the pandemic, at a time when we were struggling to understand its cause, its severity by illness, the symptoms that would be of potentially early detection, we at the Centers for Disease Control all read the very first report published in March of 2020 that noted of the 4,000 initial cases investigated and reported by the CDC, 96% of those cases lacked any clinical information or context. In other words, our $35+ billion investment resulted in effectively nothing to contribute to our understanding of the pandemic. That was disheartening to many of us. Worse, the handoff more generally between the doctors and hospitals treating patients in the front lines and our public health systems was woefully inadequate. We barely could get away from the old faxes and paper-based submissions when reporting these COVID cases, despite the fact that we've been sitting in a sea of modern technologies in almost every other aspect of our lives. My personal frustration led me to step up and basically volunteer with localities at the federal, state, and local level, organizations that were willing to step up and try to close these gaps. City of Chicago, as an example, tapped a local academic medical center led by another proud South Asian American, Dr. Omar Latif, who volunteered his resources at the academic medical center to serve as the back-end technology platform for the city of Chicago. And overnight, hundreds of thousands of medical records finally could be tapped by the professionals in the health department to make smarter decisions and to understand the severity and progression of this deadly disease. I share all of this with you as we prepare for the world beyond COVID. For sure, we are making progress on these basic, what would be obvious systems failures: improved information sharing, improved capacity planning, understanding what resources we need and where and how to allocate them, basic supply chain principles that we're now hoping will be put into production as we prepare for what might be the second wave, third wave, and future pandemics. But I thought this book was so timely because the last thing we want to do is to simply fix the broken processes that we see so obviously in front of us. We need a new foundation for a modern healthcare delivery system. And the vision, as written in this wonderful book, which again, I will not disclose all the detail, but does point out a number of key attributes that we've been calling for during my time in government and now in my time outside. I'd love to share just a few words about three specific areas where I believe the book aligns with, I believe, broad consensus, bipartisan consensus on where we can move the system forward. Number one, it is obvious with all of the inequities that we're witnessing, whether they be racial inequities, income-based inequities, geographic-based inequities, what we understand is that access to the US healthcare system, as we know intuitively, but see starkly in the pandemic, is a tale of haves and have-nots, a call to action to ensure that we have a next generation safety net that's a blend of physical and virtual assets so that every American can get access to preventive and timely care, to forestall disease progression, to remain healthier for longer livelihoods. It is long overdue that we strengthen. And with modern technologies, we can complement what would otherwise be a fairly significant capital investment with an overlay of services that may not be as accessible in every corner of the country, but should be by tapping into these emerging digital services. Second, I do believe it is high time that we flip the model from fragmented institutional data sharing to one that is organized by and for patients. A patient-controlled healthcare system is now the US law of the land. It is a bedrock principle in the Government of India's modernization scheme, both with respect to the insurance model and the new electronic health records program. And it is critical that we stitch together all of our experiences from the times we visit our primary care offices, our specialty clinics, hospitalization visits, and we access these insurance benefits that remain a competitive marketplace. If we could tap all of these resources, I believe there'll be a whole new economy born, organizing that information to advise us on the very next step that we should take to keep our loved ones healthier. Third, and perhaps most importantly, as it relates to this business model of healthcare, I am grateful for the language written in this book that includes the idea that more accountability and more control, financial control over our healthcare system should be in the hands of the American people. The idea of health savings accounts that are enhanced, that can cover more services, become part of our routine, allow us to make smarter judgments, to make sure that we're pursuing with our trusted physician partners to make the best decisions in the interests of our health and for the overall well-being of the American people. These principles, strengthening access, building a patient-centered system, and developing a modern, more accountable relationship with the American people and our healthcare system, these are just elements of a plan to make the system work better, learning the lessons we've gotten in the COVID dilemma. I'll end with this. It is my view that our two great nations are in a unique position to lead in this future. As we think about the broader economic competitiveness landscape, the world is clearly aligning on a US axis or a China axis. And as India aligns in a bit more towards the US, we have an opportunity to think about, what does next generation economic growth look like? How do we lift more people up? How do we ensure we live healthier and longer lives? How do we ensure that everyone has access to education and basic services so that they can live their lives in dignity? To me, beyond COVID, beyond this pandemic, a new coalition to strengthen our social safety net, to extend and improve our healthcare system without breaking the banks of our global economies will be a critical feature. Ambassador, Doctor, thank you so much for what you've done and for inviting me to share a few words with you this morning.
Thank you, Aneesh, for sharing for this wonderful keynote address. Now for the official unwrapping of the book, I request the host to run the video. Well, I now welcome the authors of Beyond the COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare, Ambassador Kapur and Dr. Joseph Chali, to talk about the book. Neither of them need introduction, but here is a very brief background. Ambassador Pradeep Kapur graduated from IIT Delhi and joined the Indian Foreign Service, attaining the rank of Secretary, Ministry of External Affairs, Government of India. Described as a luminary diplomat, he was the first in his batch to be appointed as ambassador in the year 2000. and was India's ambassador to the Kingdom of Cambodia and to Republic of Chile. He is a linguist and speaks many languages, including Spanish, French, etc. Ambassador Kapur has many publications, which include Profiles of Partnership, 50 Years of India-Nepal Cooperation, India-ASEAN Relations, Tak Prom, A Glorious Era in Angkor Civilization, India of My Dreams, Connecting World Heritage Sites and Civilizations. He's a visiting scholar at George Washington University and serves on the board of Wheels Global Foundation and also leads the Smart Village Initiative as the executive director. Dr. Joseph Chali, MD, MBA, FSCHE, author of several scientific and research papers in international publications, is the chairman of the Complex Health Systems Advisory Board, H. Wayne Huizinga College of Business and Entrepreneurship at Nova Southeastern University in Florida, and a member of Dr. Kiran C. Patel College of Allopathic Medicine Executive Leadership Council, a veteran of the US Navy Medical Corps. He is board certified in healthcare management. He has been awarded fellowship by American College of Healthcare Executives and International Professional Society of more than 40,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. Dr. Chali is the chairman of Indo-American Press Club, the largest ethnic Indian American media forum to help shape a world that is fair, just, and equitable for all and future generations. He is an expert in US healthcare policy and a strong advocate for patient-centered care. With years of experience working in the US healthcare system, he discusses the challenges of healthcare delivery, including providing quality healthcare, quality, affordable patient care to all, and alternate templates for health insurance. So I begin with asking the very first question, which is often asked to the author. So what inspired you to write this book? What motivated you? Ambassador Kapur and Dr. Chali.
Thank you very much, Yogesh. First, I wish to thank everybody for joining us from all over the world, different countries. Good morning and good day to everybody. And I thank our co-panelists, including the ones who have already spoken. Suresh, Shenoy, President of Wheels. Aneesh Chopra, former CTO, Obama administration. Sundy, President of PANIIT USA. Dr. Sudhakar, President of AAPI. But most of all, very special thanks to Joseph Chali, my friend. Thank you. So here is the book. And I'm going to unwrap it before I answer that question. So here we have the book release. Thank you. So what motivated us to write this book? For me personally, when I scanned the world horizon during the COVID times which we are in, and then I started doing a little bit of reading, and then, you know, one of the inspirations was Suresh Shenoy, who said, let's start a webinar series while we are stuck at home. So I was to deliver the first webinar for Wheels globally. And then I realized while doing my study and search and research that something which had happened in 1918, the Spanish flu, the solutions which we used at that time, the messages which went out at that time, the official approaches, messaging, communication to the citizenry, if you replay those images, they are the same. So in over 100 years, in over a century, while mankind has made so much progress in so many different fields, we have reached the moon, we have these smartphones, and smart cars, smart everything, but no smart response to the COVID-19 pandemic. Fortunately, the Earth had some positives, had many negatives also, but some positives such as the internet, such as the Industry 4.0, which we are in currently with all the technologies available to us. So today we are able to talk and communicate with the rest of the world from the comforts of our home, work from home. So I said that to myself, I was reflecting and thinking and introspecting that today we are in a position where the most powerful leaders and the most powerful countries are totally powerless. They are affected by the virus themselves. You see President Trump, you see Pierre Trudeau in Canada, you see in London Boris Johnson, you see the Home Minister of India with COVID, infections in hospital undergoing treatments. So I said, here is something which the world needs to pause, reflect, and think about the way ahead. So to make a start, we thought, let us start this conversation and write a book. And Joseph Chalil has been a great support and great friend and great colleague. And I'm very proud of him that this book, while I've written 4-5 books before that, as was mentioned earlier, this has come out the fastest in record speed and beats the deadline of the US presidential elections, because this also talks about how, while I've been here, I see that there is a lot of dialogue and debate about, even Aneesh Chopra in his brilliant keynote has mentioned about how, the Democratic Party has one view and the Republican Party has another view about healthcare, whereas this book proposes a bipartisan attitude. I want to correct him there. This book proposes a non-partisan attitude. It is not left or right or Democrat or Republican or this country or that country. There is a global view of healthcare for the world to see the way ahead. Thank you.
Thank you, Ambassador Kapur, and thank you all the panelists for all the kind words and all the support for this book. I see several of my physician colleagues are joining as panelists or as participants in the webinar. I see several names who are very close, who are, and this problem is no secret than what we had before. So the purpose of writing the book was, even though access to care in this country was always a problem, we were, again, one of the wealthiest nation in the world. We spent a lot more than most countries combined in our healthcare per capita. But the outcome we get are not ideal. But when the COVID struck, it exposed our weaknesses even further, in the sense we see doctors sharing masks. We see doctors wearing the same mask for days, and we were given rationing like a one mask at N95 mask per week. That was the beginning when one of my physician colleague in Fort Lauderdale told me, he would get only one mask per week to go see patients. That's unacceptable, in a country like ours. This shouldn't happen. This is not like this is the first pandemic, as Ambassador very well said. And I am afraid this may not be the last pandemic. So we thought, why don't we come together, create a common sense, non-partisan healthcare reforms, ideas which can then be taken up by all parties. And hopefully we can have a better system, we'll be better prepared for either it's a next pandemic or a natural calamity or a war. It doesn't matter. There are several pieces in this book. I mean, we talk in detail about a grand plan in chapter 7. We talk about empowering the patient. Ultimately, the patient has to be in charge of his or her healthcare. We cannot, afford overutilization. And then the question was, is insuring everybody is the only way? Or is there another way around it? So So that's what this book talks about. And I'm very grateful for Ambassador Kapur's support and getting this book out in record time. Thank you so much to our publishers and everybody who supported us. Thank you.
Thank you, Dr. Chali. This is a very timely book. You have studied various different healthcare systems across the world. So would you like to share some of the learnings that you observed while researching for this book from different healthcare systems across the world?
Sure. I think for the purpose of this book research, we looked into how the UK, healthcare in the UK works. We learned there are several new aspects which are coming in, even though initially they had a hiccup with the COVID control. But once the Prime Minister himself was infected, they started taking it seriously. But they had some fundamental benefits compared to US. They had as Aneesh had mentioned, they do have a infrastructure in place on sharing healthcare information. They had some companies which we talk about in the book regarding patient-controlled electronic medical records. Some of them might have helped. We also learned lessons from the Canadian system, how they are handling it, and even more importantly, how India is handling it. With one of the largest population, I would say the largest population in the world as we speak right now, and social distancing as we speak here. It's not that practical, in a city which has a lot of, citizens who live very close by. So it is not easy. So the point is, no matter which country worldwide we try, no system is perfect. We cannot just isolate ourselves unless you are, maybe in an island or a continent far away. It is not easy. I myself was in China for New Year's. And I've been hearing about it from Shanghai, what's happening in Wuhan. And I wish the world knew earlier of what was happening. I was able to order some masks on Amazon before I landed in this country. So I was able to get some and I was giving it to my doctor friends locally. But not everybody knew that. I'm afraid the people whom we trusted to protect us, like the UN and the WHO, may have failed in this aspect. So as we talk about in this book. So yeah, lessons learned, but a lot more to fix.
Thank you, Dr. Chali. Moving over to Ambassador Kapur. Ambassador Kapur, what's been your observation, your research and study about the way global bodies, global agencies responded to this pandemic, and what do you advise should be done in future should we face such a problem again?
Thank you, Yogesh. Thank you very much. Now, having worked in all the different continents of the world except Australia for long periods at a stretch, 3 years, 4 years in Africa, in Tanzania, 3-4 years in South Asia and Nepal, 4 years in Cambodia, then 3-4 years, 5 years in Chile, in Latin America, in the US, in the UK, in France, in Spain. So seeing all the sort of, countries, regions, continents, working in different ways, you get some understanding of how the world works, how the health systems work. And what I realized was that in 1945, after the World War, the League of Nations, which had existed till then, but had failed to prevent the First World War and the Second World War, the leaders of the world got together and decided that they needed to create something new which would be able to cope with the new challenges. And the United Nations was born. From the United Nations was born the World Health Organization. Simultaneously, in another meeting of the global leaders in Bretton Woods in New Hampshire, it's called the Bretton Woods Institutions were born. The conference was held there. So it's even today called Bretton Woods Institutions, the World Bank and the International Monetary Fund. So all these organizations have been working, very hard through these decades since the late 40s till, let us say, this period of the COVID pandemic. And many of them have had good success because they have kept on evolving, changing, adapting, improving, reinventing themselves, like the World Bank. And they've been very successful at it. The United Nations spawned many other organizations, UNDP also, UNICEF also, UNESCO also, ECOSOC also, so many other bodies, but sort of was not very successful in this reinvention of itself. So far, has not been for decades. Now there is a clamor for reforms. For example, just as a small example, in the UN, there is a Security Council and there are permanent members. Who are these 5 permanent members? US, UK, Germany, China, and Russia. Now, for all 5 of them to agree on any global issue of importance, like the COVID pandemic and the responses globally, gets stymied because of the veto powers which these 5 countries have. So if one country is proposing something till all 5 agree, it is not an easy job for the United Nations to take a quick decision for global action. As Aneesh was mentioning, call to action. So what happens with that? Most of the time it has been observed in the UN Security Council that countries mostly like Russia and China have used the veto power much more than the others. So there has been call for reform of these veto for these permanent membership, because they said it needs to be more representative to the realities of the world today. What are the realities? There's a country, India, which is a very important global player. It is not a member of the permanent membership.
Sorry to interrupt you, Ambassador Kapur. There are a lot of questions. Be brief with your comments.
Yeah, let me just conclude with that. In the sense, some country from Latin America is required, like Brazil, Germany, Japan, India, and some country from South Africa to make it better, work better for the world. But that is not able to happen because, again, of these veto powers. So similarly, WHO has failed to deliver and has been found wanting in times of these crises. So what we want to propose to the world is a conversation on the way ahead for the future, whether they need new organizations or there is any capacity within these organizations to reinvent themselves. Thank you.
Thank you, Ambassador Kapur. We'll come back to discuss about what kind of a new world order you would like to envision. But at this point of time, let me turn towards Dr. Chali. You have researched a lot of technology, how the exponential technology can be used to respond to pandemics like COVID. So could you please elaborate, share your views, your observations, what your research findings and studies tell you?
Technology is changing. We have new in the marketplace now, as you all new iPhones with the 5G capacities. We have AI, machine learning. We have several other new things coming in. We have our own Dr. Sudhakar, who the surgeons are changing the way they do surgeries using robotics. We have coboting in place. So in the book, in the chapter 5, we talk a lot about what's evolving technology. But the challenges are, even with the technology which is existing, like the technology you're on right now, like Zoom meeting. Imagine if a doctor were to see a patient using just a telemedicine or tele-video call. Many of the places are not, even though recently it's been increasing, our insurance system were not reimbursing for it. A doctor who is licensed in New Jersey couldn't see a patient who is in New York, because the system required that everyone has to be locally licensed. A pharmacy based in New York could not ship to a patient who is in New Jersey without having a local pharmacist on board. So our system is maybe 10 to 20 years behind every other industry in technology. We are so fragmented that if a doctor used to have multiple state licenses for the purpose of telemedicine, you have to keep malpractice insurance in all those states, and it's unaffordable. So this system needs to be fundamentally changed. We need to have a national licensing program before we can even implement technology. We need to have our electronic medical records. Now you see, a hospital in New York, if the patient travels to Florida, where I am at, as a snowbird, his medical record in that hospital will not get transferred over because HIPAA blocks it. So we need to make sure that we have enabled like something like a patient controlled medical record like we have in the UK right now, we talk about in the book here, so that we can enable patients to be in charge of their medical records. But again, I'm not sure any of the AIs and or robotics will replace a doctor, but there is a shortage of doctors coming in. And in this book, we're talking about creating a lot more hospitals. We're talking about thousands more hospitals in every county in the country. Yes, we will need more manpower, and we can only do that by using technology where one doctor can see in several counties at the same time, using the technology what we have available. But it is not that far away. We need fundamental reform before we can make it happen.
Thank you, thank you, Dr. Chali. Ambassador Kapur, would you like to share your views on what being a technology background person, what would you like to add to what Dr. Chali has said?
What I would like to say is the following, that instead of, repeating what he has already clarified, I would refer all the readers to the book. And in the book, we have the foreword by a very renowned person in the world of technology, Peter Diamandis, president of X Prize Foundation, president of Singularity University. He was very kind to, write the foreword for this book. In the foreword, he has written that, thankfully, with advances in technology, we are moving faster than ever towards a healthcare system that is digitized, demonetized, and democratized. One of the most obvious examples of this shift during the pandemic has been the rise of telehealth. For example, just 11% of US consumers used telehealth in 2019. During the pandemic, that figure has been as high as 46%. Before COVID-19, the total amount of revenues of US telehealth companies was $3 billion. Given the impact of COVID-19, up to $250 billion of US healthcare spend could be virtualized. So that is what I'd like to respond to this. And further, we sort of would encourage the readers to go to the book, read more, and start a conversation globally, rather than revealing everything here. Just a little anecdote here. I remember when I was ambassador in Cambodia, we were organizing the first India-ASEAN summit. Prime Minister Atal Bihari Vajpayee was there. The 10 ASEAN leaders were there. There were a lot of intense discussions. So at that stage, when it was, when Prime Minister Atal Bihari Vajpayee's turn to respond to those points raised by the 10 leaders of ASEAN countries, his response was that if I answer all these questions now, what will be left to discuss next year? So with that, the meeting sort of ended in a very happy note, and the relationship between India and ASEAN has flourished manifold. So similarly, in the sense, we would request our readers to go to the book. It is available on wheels. It's available on the AAPI website. It's available on the PANIIT website. It's available on the IAPC website. So whichever website you click, that organization gets the proceeds of the book as donation. We will encourage you to do that more, so that you are also contributing towards charity, and it's a win-win situation. Thank you.
Thank you, Ambassador Kapur. I have many more questions to ask you and Dr. Chali, but before I ask, I'll ask the chairman of this webinar, Mr. Suresh Shenoy, if he would like to ask a few questions.
Thank you, Yogesh. This has been very enlightening. And there are a lot of questions from the audience as well. So I'll try to sort of combine them into a generic question. And I don't know if Aneesh is still online, but there are a lot of emerging technologies where science and engineering and are coming together to provide healthcare. We talked a little bit, and you talk about it in your book as well, like artificial intelligence, robotics, even 3D printing and machine learning. While we are talking about, essentially, general older technologies like digital records and so forth, robotics and artificial intelligence is disrupting healthcare in major ways. IBM's, Watson technology, for example, has been used extensively in cancer treatments. So in view of these disruptive technologies, Aneesh talked about a patient-centric approach. So can you give us your views on how policies and technologies need to be looked at in view of how artificial intelligence, robotics, etc., are fundamentally changing the ways in which medical practice is conducted? And I'm happy that Dr. Sudhakar is also on the call, so he may give us a generic perspectives on this. But I'll start with you, Dr. Chalil, if you can please give us your views and what you say in the book.
Thank you, Mr. Shenoy, for the wonderful question and for the people who are attending. Again, technology is increasing, it's evolving, and I'm not sure we can change that. At the same time, again, we talk about creating AI and machine learning, data mining into our own DNAs, electronic medical records. So ultimately, we believe the caveat is that we want to make sure that patient privacy is protected at the same time. You don't want an insurance company or life insurance company predicting your chances of having an illness based on your DNA analysis from 23andMe, for that matter. Similar. So again, it need to be a balance. Patient need to be in charge of what need to be revealed and what need to be hidden. So that's why I said a patient-controlled medical records. All access should be owned and controlled by patients and to whom they or he or she decides to deliver, as opposed to you give access to metadata of entire globe's medical information to IBM Watson. I'm pretty sure they can come up with a lot of interesting way to predict who's going to live 6 months to who's going to live 70 years. But are we ready for it? So there's a balance between patient privacy, patient protection, along with how do we embrace new technologies.
Dr. Sudhakar, would you like to comment on this from a generic sense? You're on mute.
Thank you, Suresh. Again, the physicians has to change their practices. You have to use more technology nowadays. Especially the senior physicians. Younger physicians, they're pretty much aware of technology because they grow with the technology. Regarding the medical records, Dr. Chalil mentioned is very important in the United States because, or anywhere. Okay, take a country like Sweden where the network is pretty good, medical record network. If somebody's listed for liver transplantation in Sweden, that data available anywhere you go. If you get sick somewhere, okay, they can understand how to retrieve the data of the particular patient and able to help them, when anything happening there. So that thing has to be changed. I think, we need to have more advanced networking of the patient history, physicals, and of course, for the last 8 months, I never going to know that I'm going to use telemedicine as an important tool now. So things are changing, and we should adapt, and we should move forward. Thank you.
Thank you, Ambassador Kapur. I'm going to ask you a technology-oriented question. Dr. Chalil mentioned how difficult it is for doctors to cross geographic boundaries to provide services. And as you know, Wheels, and you've been part of it, we are talking about telemedicine. What kind of policies do you think need to be looked at? Again, bringing it to the patient-centric view, if there are patients in remote villages in India or elsewhere in the world, how can doctors in the US participate in the delivery of healthcare in this highly connected world? And in your view, and to the extent that your book covers it, can you share with us, what policy changes, what global relations need to be developed, for such interactivity between doctors in anywhere in the world trying to help patients anywhere in the world.
Right. So, Suresh, you're from IIT Bombay, and I'm from IIT Delhi. In some respects, IIT Delhi is ahead of IIT Bombay. And even in this respect, for example, when I was there in the 70s, mid 70s, IIT Delhi teamed up with All India Institute of Medical Sciences, Medicine Institute, Technology Institute. That was the first big partnership in the country. And we had Professor Guha, who was the head of the Biomedical Engineering Department of IIT Delhi. Biomedical Engineering. So we as students decided to join that course with more interest to get an exposure to the world and to look at beautiful girls in All India Institute, though we learned a lot of medicine in the process, because we would have classes and dissection of frogs and stuff like that in the All India Institute. So we would travel from IIT a few kilometers away to, All India Institute. And that was one aspect which sort of sowed the seeds. So I have been working, for example, in Nepal, where I've been associated with the largest healthcare delivery hospital of Eastern Nepal, half of Nepal, BP Koirala Institute of Health Sciences in Dharan. Half of Nepal gets its, we have Nepalese friends on this call, so I'm mentioning this very specifically. And in other such healthcare projects, like the Bir Hospital expansion project in Kathmandu, etc. So what my understanding of the global scenario is that when we were in our technology BTech phase, we didn't have the option of computer sciences. Electrical engineering was omnibus subject. Then slowly, as we started working, we realized that computer sciences is there in every part of your life today. So in medicine, what I learned in the course of writing this book from my co-author also, is that medicine is one field where it is still a decade behind in terms of adapting technology and learning of technology and computer sciences. So that is one action which is needed globally for bringing it up to speed, because that is how it will expand its access manifold. Thank you. But we need to look in the book also. There are a lot of solutions we have talked about, and that'll be more interesting rather than discussing it in detail here. But it'll be interesting to carry on the conversation and realize as to what are the other possibilities.
Thank you. Thank you. I'll ask one more question and hand it back to Yogesh. And given where we are today, where doctors, policymakers, legislators, insurance companies often don't see eye to eye, but are working towards a common goal as to how to improve healthcare. What advice would you have to this younger generation based on your book? Where should the emphasis be when it comes to patient care? And we talk about patient-centric policies and healthcare delivery. Dr. Chali, your thoughts on what kind of, if you were to give 5 key takeaways from your book on how to change policy, what would they be? And, how would you bring all these different communities together?
Sure. Thank you, Suresh, for that question. I believe the primary purpose, I would say, is that we need to empower the patient to be in control of his or her own health. It shouldn't be chosen by the insurance company or the hospital on, what medicine they take or what procedure they should do or how many days they stay in the hospital. That should be a decision between the patient and his or her doctor. So they should be left alone to practice the art of medicine, as opposed to being mandated by financial restrictions and coding and billing and all those things. Number one. Number two, I would say we need to make sure, in a country like ours, we need to make sure we need to give access to everyone, irrespective of their race, irrespective of their financial ability, irrespective of their numbers or documents or whatever it might be. Everyone should have access. And the third thing I would say is that we need to make sure our sourcing or manufacturing for medical supplies, which is essential in the sense, in a time of pandemic, we don't need to be there are several stories given in the book. We need to be begging other countries to ship masks or ventilators in short notice. And that is that's unacceptable for a country like ours. We need to make sure that we learn from history. We learn from how our military does purchase and manufacture locally the products, what it needs. And the third thing is we need to have a clear medical reserve of supplies. So it is not like an empty shelf of ventilators which doesn't work. We need to learn from what the history did with our strategic petroleum reserve. We need to make sure we have enough supplies. We need to make sure we have enough excess capacity of beds, ventilators, ICU beds. So we talk about creating a lot more hospitals. We talk about creating hospital ships. We talk about creating several other ideas. And last but not the least, we need to create more manpower to manage this, again, with assistance of technology. But technology, you cannot immigrate this problem out of this problem. We cannot use technology to double or multiply a doctor by 10. It just doesn't work. We need to make sure we train a lot more doctors. We need to make sure we create. So in the book, we talked about creating a medical ready reserve, which is ready to staff county hospitals in the rural areas and stuff like that, and be ready to be deployed. So we need to make the manpower. So the 5 aspects I mentioned, from patients in control with the doctors, from supplies, solutions, manufacturing, brought back to US and essential in military, and raising our own new doctors, new medical staff, retraining them in this employment issues when people are losing jobs. How do we retrain many people who lost jobs into paramedical staff or nursing programs, things like that? So, yeah.
Thank you. Thank you. I know that these topics are covered in great detail in your book, and it lends itself to a general reading, not just by policymakers or others, but every one of us should be reading this. So thank you. Ambassador Kapur, do you have anything to say to that? Or?
Well, I am, very happy that we have very interested participants today. So I'm just going to read out a chat which has just been put live by Peter Kim. I personally do not know him. I think he may be, a friend of Joseph's or somebody else. I don't know. But thank you, Peter Kim, for your comment. I'm going to read it out since it's marked only to the panelists. I'm reading it out for the attendees also. A wake-up call to the world leaders and current policymakers around the globe, and a must-read for students who may partake in the next grand plan. Well written for all walks of life, easy to understand, and make you think about the next global health policy implications on world's health system. Congratulations, Ambassador Kapur and Dr. Chalil. Peter Kim. Thank you, Peter. That was a very beautiful comment. We are touched. We appreciate that very warmly. So, Suresh, to answer your point, I'm just going to mention what Amitabh Kant, the Chief Executive Officer of Niti Aayog, which works in close association with the Prime Minister's office in India, has written in his special message for the book, which is contained in the book. Beyond the COVID-19 pandemic is a book which can perhaps serve as the starting point for such a global conversation. It not only analyzes the policy responses to the pandemic, but also brings the role of technology to the forefront and subsequently delves into strategic future planning and envisioning a new global order. It encapsulates the policy and technology realms in a lucid manner, presents a unique yet simple model which can be tailored to suit countries across the world and better equip us all to deal with such pandemics in the future. A body of work which presents a ray of hope for the future. This book is a must read for healthcare professionals, policymakers, technopreneurs, leaders, administrators, and citizens alike. So I'll stop there with my, these comments to this question, in the sense that, they have put it in a very beautiful manner and lucid manner, which explains the situation very well.
Thank you. Over to you, Yogesh.
Thank you. So I guess we have a few more minutes to take some more questions from the audience. Now, here is an interesting observation and a question which either Ambassador Kapur or Dr. Chali may like to answer. A big challenge through this pandemic has been authorities curating the flow of information. This is understandable to ensure panic does not ensue. However, this also makes it difficult for people in certain cultures, environments to take these threats seriously. So what are some interesting ways we can leverage technology and globalization to ensure the spread of truthful knowledge and reduce the global death toll?
Joseph, would you like to go first?
I'm sure. Again, you can see worldwide there are several ways the governments have been sharing information regarding the patients next to you. You know, the India has its Arogya Setu app, which tracks patients who are positive on COVID-19, and it gives you warnings if you are near another person who were proven positive. Because it tracks your location, it tracks your Bluetooth activity, it tracks which Wi-Fi is connected to. And most other countries have such apps in place. In the US, there are few states which are turning it on. I mean, your iPhones, your Android phones are ready for it, but not in every state. So, we give our personal freedom, privacy in this country, sometimes maybe more than the common good of the people. So that's a debate which is beyond the scope here to happen. But ultimately, I believe we need to have a balance without panicking people. We need to inform people on what's happening, what they can do. Again, similar things like wearing a mask. It takes a long way to preventing the disease from spreading. And it's not partisan politics. It doesn't matter which party you are in, whether you're Republican or Democrat. Virus doesn't discriminate. Virus didn't discriminate whether it was President Trump getting infected, or is it some campaign staff at VP's office of the running mate of the opposition party. So, thank you.
If I may add my comment here at this point. Technology is a tool, and it is like a double-edged sword. You can use it positively and you can use it negatively. Now, if you're using it positively, it's going to be very advantageous to mankind. Many countries are having different uses for technology of monitoring, managing, controlling human rights situations. So those sort of countries, I don't want to name any countries because it's not a political discussion. But if the uses of technological advantages are managed in a way that benefits the citizens of the world, I think we look forward to seeing an era of plenty. We have discussed in the book about how technology may ultimately meaning not too far into the future, maybe in the next decade, empower the citizens of most countries in the world to become the CEOs of their own health. So, that sort of impact can also happen, and we are looking forward to that sort of impact happening, where everybody, gets a better life. Thank you.
Thank you, Ambassador Kapur. I also see some more questions from the audience, and quite a few of them are related to insurance-based model in USA. And we observe that many other countries are also trying to emulate the same thing. What do you see are the advantages and and the challenges of this system? And what's your suggestion? How what kind of alternatives can be developed for this?
Well, for me, it was a very big learning to understand the ramifications of how this insurance-based model has distorted the healthcare system completely. And my learning was also due to the discussions with my co-author, which were held very frequently, almost on a daily basis. So I would defer to my colleague, Joseph, to answer this question in brief, because there's a lot of discussion about this in the book also, and the readers will benefit a lot by reading it in the book.
Thank you, Ambassador. I think, the question is, one of the main key topics of discussion in the book is that, again, while we want to provide access and health for all, access to everyone in the country, irrespective of their financial needs, irrespective of their insurance coverage, access to healthcare, basic fundamental healthcare. the way we've been handling it, whether it is whether the politicians now, the candidates who are running for president right now are also managing it, is through increasing the coverage of insurance. It's just like, if you want to protect somebody's life, are you really giving them life insurance? If you're worrying about protecting someone's health, unfortunately, what we currently have is a disease care system. I'm not sure anyone really cares about anyone's health. You get sick, you get fixed, and the insurance company negotiates a price with the provider or with the hospital, and you don't know what happens in between, what was paid, what's not. So the patient, in effect, are only worried about how much is a copay he's paying or how much is a co-insurance he's paying, not really about the cost of healthcare, what is being reimbursed by insurance. And so, if you are, so there's a tendency, if you are highly insured, like if you have the best insurance in the world, then you tend to overuse the system a lot. And if you are underinsured, you stay away, and then you go to the emergency room once you are really sick, and then never pay the bill. So this system is not the best way of managing it. So in this book, we talk about alternatives of giving health insurance to people. At the same time, we want to make sure we are providing financial, like we mentioned in the enhanced health savings account. We want to give patients have healthcare spending account, which can be used towards healthcare expenses. Like, for example, for a health club membership, or maybe to have a nutritious meal. Why is not that covered? What if you want to hire a personal trainer and you want to reduce your weight? What if you want to you want to quit smoking? What's the incentive for doing that? What's the incentive for going to a doctor's office once a year, for your annual physical exam, or if you are over 40 or 50, or what, you want to go cancer screening, or if you are a female, you want to go for an annual breast exam. What's the incentive for you? Right now, there is none. Let's change that. Let's put patient in charge. Let's make sure there's incentives in place for the right purposes so that we can reduce the cost of healthcare, at the same time improve the quality and access to everyone.
Thank you very much, Dr. Chalil and Ambassador Kapur. I have one final question from our side before we also request Annie Koshi to say a few words after we have acknowledged all the speakers. So this question comes from one of our attendees, and for which I should first thank you for your very generous donation of the proceeds of this book to be shared by PANIIT, by AAPI, and by WHEEL. So thank you very much. I hope all the attendees will open their wallets and buy the book. It's fantastic reading. And despite the fact that I had the privilege of reading the early versions of this, I'm buying one right away. It is a must read and something to be kept on our in our library for future reference as well, to see how far along our legislators have followed this good advice. So the question is, what made you donate the proceeds to these charities? Just a few words, if you will. We can start with Ambassador Kapur and Dr. Chalil, and then I'll request Yogesh to get back online.
Well, Suresh, as far as I'm concerned, we have led a very blessed life, and to be working, for example, for the country in different parts of the world and for so many other countries to support their efforts in development. So with all that, learning, living in different cultures, understanding what difficulties they are facing, we have to think about, how we have been very fortunate and how sharing can give you much more satisfaction. Like Mahatma Gandhi said, we have it in the book also, the quote of Mahatma Gandhi, where he said, there is enough in the world for everybody's need, but not enough for everybody's greed. So from that perspective, if the COVID pandemic teaches us that, it will make you a much happier being. And you have already so much. You have received so many gifts and blessings. So just by, sharing some part of it with the community, with the world, it will make you also very satisfied and happy internally. And you are doing a little bit to what the world has given you. So from that perspective, I thought it's the best thing to do in this case. Thank you.
Thank you. Dr. Chalil.
Dr. Chalil, would you like to make some observations?
Sure. Again, thank you all for the opportunity for giving us this platform to spread the word around. Before I say why I do that, I just want to say thank you to all the faculty and students who are joining from Nova Southeastern University. The complex health system MBA programs. The only purpose what we are asking, all these new students of healthcare administration, the new doctors who are coming in, the AAPI doctors who are joining in, is to think outside the box. You don't have to just think that this is the only way to deliver healthcare. We don't have to insure everybody. We can have a better way. We can have access to patients without breaking the bank on it. But regarding coming back to the charity question, again, we dedicate this book to all those their lives were lost to the pandemic globally, especially essential services and healthcare heroes, and all those doctors, with under Dr. Sudhakar's leadership, and nurses who dedicate their lives day and night, for the health of humanity. I speak to doctors that they haven't seen their family for weeks because they isolate themselves because they don't want to get sick. So this wasn't a happy book to write. Every time we were making a change in edition, I recorrect the numbers of patients who were affected and the number of death numbers. And it's like within 2 days, the number's gone up, 100,000. It's just, it was really sad to write. So if we can spread the word around, help the charity at the same time and the healthcare workers and healthcare heroes, that's what we want to do. Thank you for your support.
Thank you. Thank you, Dr. Chalil and Ambassador Kapur. There are many questions which we have not been able to pick up due to paucity of time. And I would suggest that we take these questions offline and through some mechanism, either through website or through direct emails, we respond to many questions that have been asked to us. So thank you very much, Aneesh, Ambassador Kapur, Dr. Chalil, Sundy, and Dr. Sudhakar for your excellent and insightful remarks. Thanks also to the entire team of volunteers and collaborators who worked very hard to make this event happen. There are many key takeaways from today's book launch, which are very eloquently presented in the book, Beyond the COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare. Please be sure to go on our website, www.wheelsglobal.org, to buy your book today, where you will find all the answers to the many questions and understand why this book is a must read for everyone. The hard copy edition is only available on this site, and donations above $75 get a signed book in the mail. If you make a donation of $500 or more, the authors have offered to have one-on-one video call with you at everyone's convenience. Please donate generously and buy the book. It is very topical, and every penny you give goes for a worthy cause. A link to today's event and the recording will also be available on our website, www.wheelsglobal.org and www.wheelscharitables.org, where there is also a donate button. Over to you, Suresh.
Thank you, Yogesh, for a wonderful job of moderating. That we could have probably gone on for a few more hours. It is such an interesting and timely topic. I want to add my own thanks to Aneesh and the authors, Ambassador Kapur and Dr. Chalil. Thank you very much for your generous donation and the wonderful insights that you shared with us. Just a little plug for our forthcoming event, which is on October 23rd, which is next Friday, on education. Ajit George from Shanti Bhavan, Vinita Saraf from Ektara, and Rashmi Misra of Vidya, and Professor Kannan Mudgalaya and Dhritiman Banerjee will be talking about how the poorest of the poor need to be educated, need help with that, and all excellent initiatives and experiences that are not to be missed. So thank you very much again for your support to carry on these webinar activities. Ambassador Kapur and Dr. Chali. Thank you. However, before concluding this event, I would like to recognize the Executive Vice President, Annie Koshi of the Indian American Press Club. Annie has also launched her award-winning book, How to Be Your Badass Self, a guide to using your inner energy for brand success. Over to you, Annie. Thank you very much for also sponsoring this event. Over to you.
Thank you so much, Suresh. It is an absolute pleasure to be here. And first, before I begin, I'd like to say congratulations to Ambassador Pradeep Kapur and Dr. Joseph Chalil. Your accomplishments today, well, before I start, good morning, good afternoon, and good evening to all of you, especially everyone who's taken the time to join us on our Facebook Live or here in the webinar. Now, on behalf of the Indo-American Press Club, it is my sincere pleasure to be representing not only the Indian media fraternity in North America, but also to be here as a fellow author. The journey to write a book begins not with the first word on paper, but rather a dream. That's planted in thought. It takes a lot of courage, dedication, and perseverance to write and complete such an arduous task. I do want to say congratulations again to both Ambassador Kapur and Dr. Chalil, who is also the chairman of the Indo-American Press Club. This is an outstanding achievement. Now, I just want to share very briefly with you what's going to be happening immediately following this meeting. I would kindly request you to log into our meeting with the shared IAPC Zoom link. We will shortly be starting our 7th annual International Media Conference. We expect several prominent dignitaries, media leaders, and government officials to be in attendance. Now, some of the highlights from our event will include seminars and discussions today on freedom of the press in India and the USA, as well as cybersecurity and social media. Now, tomorrow, Sunday, I'd like to invite you to join us at 11 a.m. Eastern Standard Time or 8:30 p.m. IST for the US presidential debate, followed by a seminar on India's relationship with other countries, especially that with USA and Canada. We're proud to recognize Wheels Global Foundation with an outstanding award during our closing ceremony, along with several other prominent leaders on Sunday. So once again, thank you for your time and effort and your support. Stay safe and keep well. Enjoy the rest of your weekend.
Thank you very much for that wonderful recognition. That's quite a surprise. Thank you very much, Dr. Chalil and Sudhakar and Sundy for joining us. We would not be here without PANIIT. So Sundy, special be what it is today. Thank you, Sudhakar, for your collaboration. Thank you, Annie. Thanks everyone for joining. Thank you, Ambassador Kapur and Dr. Chalil. Good luck with the book. Thank you, and we hope you sell millions of copies. Thank you.
Thank you.
Thank you very much. I appreciate that. Thank you. So we are running the PowerPoint separately. The link I posted here so that people can keep on copying the link and joining the IAPC meeting. While on this link, the PowerPoint will continue. The IAPC meeting is starting. So people can join that with the link here. Thank you very much.
Thank you. Bye-bye.
Bye-bye. All the best. See you there.